Hello and welcome to Threefold Herbal Healing. I'm herbalist Leo Sade. I help people who struggle with chronic conditions grow their health from the roots up. This video today I'm recording is about PMS and PMDD. This is really a topic that is close to my heart because I struggled with PMS for most of my fertility years. My symptoms were both physical, so I had water retention, bloating, and breast tenderness, but also emotional, depression, and mood swings. When I would lose my mind and become irritable, and let's be honest, I was pretty bitchy. I would call my best friend and rant to her about my mood swings and my bitchiness and how a bad person I am. I felt so much shame and guilt about the way I was feeling and the way I was behaving. And she always would say, Ollie, oh, you're getting your period soon, aren't you? Which was always the case. At the time, nobody talked to me about PMS. I always thought that something was broken with me, that I wasn't okay because I was having those symptoms. However, at the same time, I thought it was a regular part of menstruation, like a force of nature that you had to endure but could never change. Today I know better. PMS is a story that your body tells you about its well being. The following statement from the ACOG, the American College of OBGs committee, emphasized the importance of monitoring your body and identifying PMS symptoms that might require attention. So let me read it for you. Identification of abnormal menstrual patterns in adolescents may improve early identification of potential health concerns for adulthood. It is important for a clinician to have an understanding of the menstrual pattern of adolescent girls, the ability to differentiate between normal and abnormal menstruation, and the skill to know how to evaluate the adolescent girl patient. By including an evaluation of the menstrual cycle as an additional vital sign, clinicians reinforce its importance in assessing overall health status for patients and caretakers. So it is for clinician, but it is for us, for each one of us as a woman to learn how to evaluate your symptoms. So what are we talking about when we are talking about PMS? PMS is a cluster of symptoms that begin about a week to 10 days before menstruation, before your period, and end once you start your period. If those symptoms don't magically disappear once you begin to bleed, then they are not a manifestation of PMS. That is important to know. For many women, PMS manifests only in emotional symptoms. And when I talk about emotional symptoms, I'm talking about brain fog and hard time focusing, mood swings, irritability, sensitivity to rejection, self-critical thoughts, depression and sadness, anxiety, and really low motivation. Some physical symptoms that are associated with PMS are food craving, fatigue, breast tenderness, fluid retention, sleep disorders. So some women sleep 10 hours a night and some women cannot sleep more than 5, 6 hours. Acne, headaches. While PMS is common, a smaller number of women experience PMDD. In PMDD, the symptoms are similar, but their manifestation is much more intense and debilitating. So, for some women having an emotional depression with PMDD, it will become even suicidal ideation. It's like it takes everything one step more intense, more extreme. If you're struggling with those symptoms, please know that you are not, it's really not in your head, and you are not alone. It happens to so many women. We just don't talk about enough. So let's understand what's happening in the body and why do you have those symptoms. The primary energetic pattern of PMS are excessive heat, excitation, and congestion. Excuse me. Signs that point toward heat patterns are irritability and anger, that are classic heat emotions, breast tenderness and swelling. It creates inflammation and congestion in the body. Headaches, often tension type from heat rising up into the head. Food craving, especially sweet, salty food. Heat driving excessive appetite. Bloating with distension. And this is when heat creates expansion. Signs of congestion pattern in PMS are fluid retention, circulation become very sluggish and you retain fluid, breast enlargement, you have lymphatic congestion in the breast, digestive sluggishness, liver congestion affecting hormone metabolism, and mental and emotional stagnation. It's like the thought becomes stuck in a negative loop. So what are the root cause of PMS? Although PMS is a reflection of hormonal imbalance, if you look under the hormones, you will find that the root cause are much more complex, like with everything in your body is connected. So let's talk about the hormonal imbalance. PMS typically occur in the second half of the cycle, known as the luteal phase, when progesterone is dominant and estrogen levels are low. In the brain, progesterone becomes allopregnanolone, a neurosteroid that affects GABA receptors. During the luteal phase, progesterone level rise along with those of allopregnanolone. Allopregnanolone is calming, it's anti-anxiety, it has the effect that soothe and calm and relax the brain. If pregnancy didn't happen, progesterone level begin to decline about a week before the menstruation. Precisely the time when most women will start to experience PMS. A much more dramatic fall in progesterone happens about 48 hours before you start bleeding, and that's coincide with the worsening of the symptoms. So what really happened? PMS is basically a withdrawal-like symptom from allopregnanolone that is experienced by women with heightened sensitivity to the fluctuation in progesterone and allopregnanolone levels. So there are a couple of key factors that affect your response to this decline in progesterone and allopregnanolone. One is how efficient is your body in converting progesterone into a metabolite such as allopregnanolone. If to begin with you don't have enough and then it's drop even more, and how sensitive is your brain to those fluctuations. But it's not only the fluctuation of hormones in the body and brain, it's also about your metabolic health. When your metabolic health is compromised, your insulin level will increase significantly before you experience high blood pressure or insulin resistance. So even if you do the routine blood test for insulin and fasting glucose and high blood pressure, and they all look okay, insulin might be higher before you even start to have insulin resistance. When that happens, it's increased sex hormones binding globulins. Those proteins bind to your hormones and prevent them from performing their job. So you have this protein that is increased when your insulin is high, when your blood glucose is high, that actually bind to your hormones and hold them so they can't do what they need to do. So even if your blood test shows that you have enough estrogen and enough progesterone in your blood, this amount that is not available for your cells, and you get an hormonal imbalance. It doesn't stop with your metabolic health. It continues with stress and PMS. It all starts in the hypothalamus and cascades down through the pituitary gland. When I say it all starts in the hypothalamus and cascade down, I mean both reproductive hormones and stress hormones. Both of them are managed by the hypothalamus. In acute stress, the hypothalamus cascade will lead to cortisol release in the adrenal gland. Cortisol increases alertness, blood sugar, and cardiovascular output. Short-term increased cortisol is an adaptive survival response. You want that. However, the same response, when it becomes chronic, lead to high blood sugar and insulin, reducing your availability of reproductive hormones. Pregnenolone, a steroid hormone, serves as a precursor for reproductive hormone and for cortisol. In chronic stress, your body will prioritize cortisol production, leaving less available for sex hormone synthesis. So when you have high level of chronic stress, you will produce more and more cortisol and less progesterone and estrogen, which will create an hormonal imbalance. One more thing is your liver. Most of the breakdown of reproductive hormones happen in the liver. Those processed hormones are mixed with bile and sent through the small intestines to the colon for you to eliminate in your poop. A sluggish liver or insufficient bowel movement, what we call constipation, mean that those hormones and their metabolites stay in your body longer and they have a longer effect on your body, which result in a messed up hormonal system. And I think last but not least is, of course, inflammation. Chronic low-grade inflammations mean your body is super reactive to any change. The same progesterone drop that might cause mild mood changes in someone with low inflammation can trigger severe PMS symptoms in someone with chronic inflammation. Inflammatory cytokines are chemical messengers that the immune system uses to communicate. It communicates cell damage with them or the presence of pathogens like bacteria and virus. Inflammatory cytokines play a crucial function role in the healing process. However, what heal you in acute condition become damaging in chronic conditions. GnRH is a hormone released in the hypothalamus and initiates a hormonal cascade that produces estrogen and progesterone. Inflammatory cytokines suppress the release of GnRH. So the downstream is a suppression of the entire reproductive system. If you struggle with chronic inflammation, the end result is less estrogen and less progesterone. Even when reproductive hormones are produced, inflammatory cytokines might bind to the receptors and compete with reproductive hormones on the cell receptors. They will reduce their overall effect. Inflammation increases stress, reduces metabolic health, and disrupts liver function. PMS symptoms are whole body symptoms because they reflect an imbalance that goes way beyond just the reproductive system. We see it, it's metabolic, it's stress, it's inflammation, it's liver. It's really a report card for your entire body. Although PMS and PMDD have some genetic components to them, you can still reduce symptoms or avoid them altogether. So a care plan for PMS will need to address all those factors that we just talked about. So what should we do? We want to address the root cause because we are not just putting a band-aid on the symptoms. Hormonal imbalance. One way to support reproductive hormone balance is to support the liver. It is the channel that eliminates reproductive hormones after their due date. So if you continue to have estrogen or progesterone that was supposed to be eliminated from your body, and you still produce estrogen and progesterone, your levels will go up. So what to do? You want to support bile production by eating bitter foods and using bitter herbs before meals. So 20 minutes before meal, eat some radicchio or arugula. Promote healthy bowel movement once or twice a day by spacing your meals. So have like 4 hours between meals. Stop snacking. And you want to use carminative spices in your cooking. Fennel, cardamom, cinnamon, or probiotic fermented food. All can help move the gut, the liver, and the gut, and help you get rid of this constipation. You want to support the liver cycle that kind of detox reproductive hormones by eating vegetables from the cruciferous family. So those vegetables are broccoli, cauliflower, Brussels sprout, kale, all that family. How to support metabolic condition. So if you want to increase the availability of your reproductive hormones, you want to reduce insulin and glucose in the blood. So you want to reduce simple carbs from your diet. And I'm talking about simple carbs, not vegetables, but those baked good, the pizza, the pasta, all of those. Eliminate processed food. Everything that comes in a box that is frozen, everything, the middle aisles of the supermarket. And avoid soda and sweetened drinks. So what to do about stress? The first step to reducing stress is actually getting a good night's sleep. So you want to prioritize 7 to 8 hours of sleep at night. You want to practice sleep hygiene, so a dark, quiet room with no blue screens. You want to have like 15 to 30 minutes of sun exposure first thing in the morning. So when you get up, you want to go out and walk for 15 to 30 minutes. You want to add movement, that walking. Magnesium helps. B6 as P5P can support GABA. It reduces inflammation and promote estrogen detox. Another factor that affects your stress is inflammation. Reversing inflammation is crucial for reducing the heat pattern in PMS. So you want to add half a pound of cold water, fish, wild caught, salmon, or sardine every week. I'm now aiming at full pounds, twice a week, half a pound. You want to add 2 Brazilian nuts because they contain antioxidants that are important for liver detox. Half a cup of leafy green, even every meal, like spinach and kale again, and arugula. Vitamin DK2, even in primos, fish oil, and you want to avoid dairy because dairy is very inflammatory. When you think about herbal support for PMS, you think about 3 groups. You want nervines that can support the mood swings. You want alternative. Those are herbs that move fluids in the body and help metabolize fluid. And you want bitters. Those are herbs that support liver detox of hormones, of everything, but hormones in this case. So some nervine herbs that can help reduce mood swings are milky oats, coolcap, lemon balm, lavender, and blue vervain. Alternative, clean the blood and improve fluid drainage. It's important for all the congestion, the water retention, the tenderness in the breast with the congestion in breath, all of that. And the congestion also, the alternative also move inflammatory waste from the body. So some alternative to consider is red clover, cleavers, and dandelion leaves. Bitters are crucial for promoting hormonal balance. They help detox hormones and prevent hormonal buildup. So some bitters are wild yam. What's nice about wild yam is that it's a bitter, but it's also antispasmodic, so it can reduce cramps in periods. And then motherwort is a bitter that is also a nervine, so it can help wash out, detox the hormones, but it can also reduce anxiety. I like this double goal with those herbs. And now I want to just focus on one herb, and this is Vitex. Vitex. Vitex has a long history of use for PMS. Studies show that Vitex stimulate dopamine receptors in the pituitary gland, and therefore it's regulate prolactin and allow a surge of LH, which eventually lead to proper ovulation. And when you have proper ovulation, you have proper secretion of progesterone in the body. So the end result of Vitex, you know, prompting the dopamine in the pituitary is enough progesterone in the system. While Vitex doesn't act like progesterone in the body, it creates the environment that optimizes progesterone production by supporting ovulation. It doesn't directly affect estrogen production. However, improving progesterone level can help balance the estrogen to progesterone level, like this ratio, which is often addressed in conditions such as PMS, corpus luteal insufficiency, and irregular cycles. It was found to treat PMS emotional symptoms, including the cyclical occurrence of depressive mood, irritability, anxiety, confusion, fatigue, and headache by binding to opioid receptors. So it's actually kind of activate those opioid receptors and just kind of make those emotional symptoms more mild, that you can handle them better, or maybe even reversing them. In order to see consistent improvement in your PMS symptoms, you will need to use Vitex 3 months or longer. So whenever we are talking about herbs, herbs don't work like pharmaceuticals. You need time, you need patience, and you need consistency. I hope this was helpful. I know that for me, it was very important to release this video because there was nobody for me when I was, having those symptoms every month. So I hope it benefit you. Thank you for taking the time to listen to me talking about PMS. And I really appreciate it if you left a message for me in the comment and let me know what you thought about this video, if it was helpful, or if you have questions. Thank you and bye. See you next week.